Hi, my name is Jeff Dixon. I'm the Technical Director for Outcome Medical of Georgia, and I'm here today to give you a little bit of background information about a diagnosis called chronic regional pain syndrome, previously known as reflex sympathetic dystrophy, or RSD, and initially known as causalgia, actually from World War II. This is a neurological condition mostly associated with very chronic pain in the extremities. Anybody can get this, although it is more prevalent in young women. The result can be from an injury or also can be idiopathic in nature, as that has no causative factor known. The primary problem with causalgia, or reflex sympathetic dystrophy, or chronic regional pain syndrome, is that it really has no known cause or no known cure. In some patients it can spontaneously remiss, and in other cases it can be continuous for the rest of the patient's life. There is no specifically prescribed medication format for it. We use typically topical analgesics, corticosteroids, pain medications, but nothing is really the one thing to do to fix this problem. It's rather insidious because it's a nerve disorder affecting the sympathetic nervous system, and that makes the patient much more sensitive not only to pain but to temperature changes, heat and cold sensitivity. Even light pressure, light touch on the skin can be extremely painful and cause burning, pins and needles pain type situation for very, very little input. We have a treatment program that we developed here at Outcome Medical that has been, in our experience, quite successful treating chronic regional pain syndrome, and it involves using our traditional integrative nerve block protocol with very special frequency modulated programs that use very highly modulated frequencies at very, very low power. The problem with chronic regional pain syndrome is they're extremely hypersensitive, and any kind of therapeutic intervention that is too intense will just cause considerably increased worsening of the situation rather than be helpful in any way. Nerve blocks have been traditionally used to treat chronic regional pain syndrome, but our combination of the nerve blocks with our own frequency modulated electric signal generation technology is proving to be quite effective. We have not a large background of cases in chronic regional pain syndrome, but I do have a very successful ratio at taking care of them and treating them and having very positive results. The following video is a testimonial from a young lady who came to us from Kansas City and was in a accelerated program. It's significantly more accelerated than our traditional protocol, but due to the fact she was from out of town, we wanted to make hay while the sun shines, so to speak. So we treated her twice a day, every day for 2 weeks, and every other day, or every day, she got a block on alternating sides, a sphenopalatine block on either side, because she has affected in all 4 limbs. As you will see from her and her mother's testimonial, this has been quite disturbing, quite interruptive to her life. It's a very active, sports-oriented young woman who has basically been, kind of sidelined with all of these problems. And we're happy to report that when she initially came to us, she was having pain scale of a 9 to 10 on a regular basis. In her words, a 7, as you will hear, a 7 was a good day. But through the intensive treatments and intervention that we provided, we reduced her pain scales to a 4, and we are hoping to continue with additional therapeutic intervention in the future.